Unique New York. Unique New York. Here we are. Hey guys, welcome to Bono Stuff. I think this is episode 63. I'll have to double check that. So we are here with Dr. Kristian Marcial. Is that how you say your name? Marcial?
Yeah,
Marcial?
yeah, you can say it that.
Right.
Marcial. Yeah,
Marcial.
Benson. Yeah.
Well, you are coming to us from. Are you in Tribeca now, or you're?
Yes, I'm in Tribeca in New York City. Yes.
Yes, awesome.
Coming
I
to
am
you
out here.
live.
I am out here in Superior, Colorado. And Kristian and I met with, he has a mastermind group for physical therapists. So he's trying to raise the profession. What is it? A rising sea brings up all boats, right? That's kind of the saying. So if we can get the whole profession moving better, it's going to improve everybody's outcomes. It's going to improve the patients, the community, and hopefully we can make this crazy healthcare system a little bit better. So I'd love to hear a little bit of how you started Tribeca Physical Therapy there in New York City, one of the most competitive markets in the world. So tell us a little bit about what you have going on there.
Okay. First of all, thanks for having me here. It's really a pleasure to be part of your podcast and to be able to reach your audience. So Tribeca Physical Therapy was born through a friendship of over a decade between me and my co-founder, business partner, best friend, Dr. Monica Saleo. So we've been friends and co-workers for over a decade. She started as my boss, and then we switched roles in another practice. I became the boss, but it didn't stop us from making the business successful and practicing how we wanted to practice. So we always make it, very like successful practice. And when the vision of that company goes a different way, and we're not going to that same point anymore that we started with, that's when Tribeca Physical Therapy was born.
Awesome. How long ago was that?
It was 5 months BC, before Corona.
I like that. That's a good one. We'll have to use that. I do need to correct myself. As you were talking, I did double check. We are on episode 63 of this fun show. You mentioned vision. We talked about vision. I would love to hear the vision that you guys started with, and has that changed and evolved over time? Or can you share that vision of Tribeca Physical Therapy? Would love to hear that.
Yeah, so the vision of Tribeca Physical Therapy is to change people's perception on how physical therapy is. That you don't need to get injured to see a physical therapist. We want people to see how valuable it is to see a good, or in other words, great physical therapist. That if imagine a world where each individual has their own physical therapist, the world would be in a so much better place.
I obviously couldn't agree with you more. I was actually at a continuing education course this weekend, and we did touch on that concept. I want to give them credit of, we're one of the only professions where it's not to have that person there for, forever and invariably, right? Come see me, twice a year for your checkup, and if you have something go wrong with your teeth. The same thing with your general practitioner, your primary care physician. If you have a specialist, that you probably have that specialist for the rest of your life. And so, I think it'd be phenomenal, and totally along with my mission. And I do think I don't want to call you out here on a live show, but I think mission and vision. You sounds like you're talking more about a mission.
Yes, it's the mission. Yeah,
the mission. By definition. So I'm sure some business-minded person would be happy to leave that comment. So I'll go ahead and beat them to the punch, and that's okay. So along those lines, again, if you could share your core values, you mentioned that in our kind of chat, and I'd love for you to share some of those core values along the lines of that mission that are going to help, again, maybe guide us forward as a profession and as you guys as a clinic. And again, I think you guys are a great example of where most clinics should be going. So I'm really excited for some PTs out there and for the general public to hear kind of the back end of what, where we could be going as a profession. So let's jump over to core values.
Yeah. So before I jump into core values, another vision, or like the vision that I always tell people, is we wanted to open 21 location in 10 years. So that's like a bold vision that we have, and each of that location, a physical therapist would be a co-owner, a partner. So in that way, they would have a sense of ownership. They would really, give them all, and not just, and learn how to be a business owner, if manager, whatever they want to do. So with that, we, the basis of how we create this 21 location is through shared core values. And in Tribeca Physical Therapy, we have 7 that we post on our wall to remind us that this is why, we're here. This is what we believe in. Every decision that we make would be based on these core values. And there are 7 of them. So the first one is trust. Second one is respect. Third one is inspiration. Fourth one is balance. Balance is something that you create. And then excellence. C is for collaboration. Collaboration is multiplication. That's why we started the mastermind PT, and authenticity. Be you, everyone else is taken. So that 7 core values is actually it spells Tribeca. So if you ask our colleague, our new hires, they should know that. They should know those core values.
Clever. I like it. Good wordplay and all that. Why 21? Is there a special thing behind that number, or?
It's something spiritual that my creative marketing manager discovered. I did it through computation, through math before, when I was doing the business model. So yeah, that will probably be unfolded in the future.
Nice. You guys are still on the 1 location though, right? 20 more to go?
Yes, we're looking at the Upper East Side location, and also maybe opening another one in the same building that we have. So yeah, especially now, this is a good time to find a new space, because New York City is, has a very high
turnover
inventory.
Yeah.
Yeah,
a lot of change. It's an interesting time for sure. And yeah, hopefully again, it's a crazy last year and a half or so, and that is something I've always been saying in these conversations that we all have, is hopefully this is an opportunity to reset for the better. So yeah, hopefully you guys, are doing that, and it gives you the opportunity to make change. And, the kind of saying in some of these spaces is the cream will rise to the top. So, hopefully that we see that with you guys for sure. So jumping over to one thing that you mentioned in your statement there is physical therapy being something that is not just for injuries, right? So tell us a little more about that, and how do we build toward that vision?
So, like for our patients, once they come to us, they see the bigger picture. Like, let me give you an example. A Columbia professor came to us for the very first time, so like on his 50s, and he never had physical therapy in his life. He had like a case where his kneecap is whenever he extends it, it's going to the left or the right, so it's unstable, and he has that problem for the longest time. And then he had his evaluation, and then he got better quick, and then he went through like the exercises that we gave to him, and then help him improve his posture. It's not just the knee that's coming for, it also helps him improve his posture. He understood better, a lot of different things, such as ergonomics, such as good proper body mechanics, proper way to exercise, understanding the body in a deeper level. And since we do clinical Pilates, it was like done in a lens of a physical therapist. So he was like amazed, and then he said, what my mission was earlier, and he said that all people should have a good physical therapist. And with that, he was able to ride his peloton better, do soul cycling, like so much more efficient. Now he can run better. Now he can distinguish what shoes he needs to wear in certain activities. So, for us, we always tell our clients, our patients, that we try to inject, like our almost a decade of of education and experience in an hour, in every hour. That's why for us, it's very important that we spend one-on-one for an hour for every patient, because we learned that would give us the best opportunity for us to have the best outcome and experience for each patient that comes to Tribeca Physical Therapy.
Yeah, that's the model I shifted to quite a long time ago myself, and I saw early on that if you're in the traditional, if we want to call it physical therapy model, that's insurance based, which requires, and I don't know if you're familiar, you might be more familiar with the statistics. I remember the last time I spoke with a few folks in New York City, based on reimbursement rates, you needed 2.4 patients an hour just to break even on most kind of real estate anywhere near Manhattan, which is where you are. So I don't know if that number's changed, but it's definitely makes it hard to work with that insurance model and to provide the outcomes that we're talking about here, right? So that is something I want to step back on here for a second and say, do you think physical therapy overall, based on, you're trying to make that change from your clinic, from your own marketing, are you involved with the APTA? Is this something you think that we can change on a bigger picture concept? I think that's something that we have as a problem, is our marketing as a profession. So I don't know, is that something you're just trying to change? We did the collaboration of, physical therapists. We can help you, you get the corona injection, the vaccine. Here's some things you can do, because we are the musculoskeletal experts. And I think that has gotten lost in a lot of ways. So yeah, I'd love to hear your thoughts on how you feel the profession is marketed currently, and is this something you're just, I'm gonna be the change I want to see in the world, or is there something we can be doing on a bigger picture scale?
So yes, I'm part of the APTA. I'm also part of the PPS private practice section. I wish I was more active, but I really appreciate and try to make use of all the resources the PPS private practice section gives. I think in terms of the physical therapist, I think if we change our mindset on how business and healthcare should be, I think that can help that can help deliver the message clearer to the public, that you need us for any musculoskeletal problem. We should be the first number one choice, because for so many reasons: the least side effects, more cost efficient, we make better relationships, so many reasons. So yeah, if also what I've experienced is, when I started the Mastermind PT, and this is why also I'm very grateful that we've done that and you were part of it too. We were able to talk not just clinically, but also how we can better our practices and model them to other practices, that we are helping each other become more successful. Because I told Helen Kim when she said she's gonna open her clinic, and I said I'm gonna open my own. I told her, even if we have the same clientele, the market is too big for us to see everyone.
Right.
So at some point, I need to refer to you, and you need to refer to me, because we know that we provide the best service. So if that kind of mindset is going to be injected to all physical therapists, it's going to up our profession.
For sure, for sure. I think that there's a recent study, and it was a webinar I attended early in the lockdown, COVID lockdown, and it was provided by Evidence in Motion, which is a very fun group that they, again, focus a lot on what the research says. And they cited a study showing that when it comes to low back pain, which over 80% of the population will be affected by at some point in their life and cause at least a week of disability, however we want to define all that, they showed through this big, I forget, it was in the thousands, survey of who would you go see first for your low back pain. And I believe the top three answers were chiropractors, massage therapists, and orthopedic surgeons. The actual general practitioner, I think acupuncturists were in that mix, and then physical therapists. So we were not doing so good as a profession as far as provider of choice, which is something when I was a student back in 2005, 6, 7, that it was something we were talking about, becoming that provider of choice for all musculoskeletal conditions. I know there are some folks in the profession who work. I miss those New York sirens you got going in the back there.
Every day, baby.
It puts me to sleep. It's my white noise. I miss it. But coming back to it, yeah, the that thing that, again, as a profession, I think we're kind of missing the boat, and it's frustrating because, like you said, we have the evidence and we can provide the best outcomes. And again, people are going to personal trainers before us. People are going to all these different professions that I listed just now. And yeah, the question is, can we elevate those around us, our colleagues, to hopefully bring the profession up? Do we need to get our names in rap songs? Because I've heard a lot of rap songs where it says, I'm back like a chiropractor. People associate back pain with chiropractic, and again, the chiropractors are very good, and they've been very good for well over 100 years at marketing themselves. Whereas we as physical therapists are like, we'll wait for you to be hurt, and that's been what it is. And now it's like we have this doctoral level education, but we don't have the marketing behind it. So I don't know. I'm just kind of freestyling. I don't think we're going to come up with the top solution here today, but it is definitely an interesting conversation. And I don't know if you have other thoughts on how we can continue to elevate that in the public eye, other than, again, doing an amazing job for individuals and educating them on the fact that PTs, if you sprain your ankle, go see your PT first. Don't wait. Don't waste a lot of time going to the emergency room or going to see your general practitioner and then getting an X-ray, maybe an MRI. Like, we can save you a lot of time, money, cost, to the whole system, and to you. Even if you have insurance that's covering it, it's costing the entire system a lot of money. So, yeah, I don't know if you have other thoughts on that whole problem that we're facing.
I guess just like, really clarifying that the message of your business, of your practice. If you say that this is what we stands for, this is what we believe in, and you're not just telling your clientele, you're also telling your colleagues that this is what we do, this is what we believe in. We should be open-minded, and this is what the clients need because it came from them. So like strengthening that message, I'm sure it will reach our colleagues, our physical therapy friends as well. That's also how I explained it to our new colleagues who joined us. So when we started our practice a year and a half ago, or almost 2 years ago, it was just me and Dr. Monica. Now we're 4. We hired 2 more therapists to join our group. It's because of that messaging. Because this is why we do what we do, and this is how we're gonna be in the future. And then if you want to come join us on our bus, we're gonna bring you to point A to point B, or sometimes we're gonna fly, and all those things, all those good stuff. So yeah, I think clarify, like being very clear with the messaging, and like you said, as much marketing as we can, and then sharing our mission and vision to everyone, especially and hopefully our colleagues, our physical therapy colleagues, would hear and actually pay attention to what we're trying to do, then our profession would go in another level, in the next level.
Yeah. So I do want to kind of push on that and ask you, what are you guys doing? I'm looking at your social media now. I like your fitness challenge of can you stand for an hour without slouching or without pain? What type of sleeper are you? And
Mhm.
are you able to lift 20 pounds without pain? What are those like kind of some of the ways you're pushing to the community to try to connect there? Are there other ones that maybe we're missing or you have coming up in the near future? I'd love to hear more on how you're talking about or trying to push the wellness, the preventative, the prehab, any of those kind of programs you guys have in place?
Yeah, this actually came from PPS. It's one of their like marketing tool that, if you remember, you can use it, the Fit Factor. So it measures like your fitness level. So obviously, if you're not fit on certain categories, then there's a chance that you get injured on some chosen sports. So it's just like it's a fun way when you have a challenge. It's a fun way to like engage people, and make them aware of like, all right, I'm not injured, but if I do certain things, if I run half marathon and my ankle is not moving on the proper dorsiflexion, or my heel is not, it's not mobile enough, it's not doing its movement of inversion or eversion, I might be, coming up with an injury. And that's what a physical therapist can tell you. Rehab. Are you running half marathon? Are you training? Are you sure you won't get injured? How about you talk to a physical therapist? I know this Dr. Jim Palmer. He does concierge medicine. He comes to your house and see. He's a marathon runner, and he can tell you all about all things you can think about with long distance running.
Yeah, that's great. So this is a question I've asked a bunch of times in the previous 62 episodes to many of my guests, and I'm curious if your answer was going to line up with that. How do you define the term fitness? Because you mentioned, if they're fit in these categories, how do you define the term fitness overall?
Ooh, I was not ready for this. You didn't prepare me for this. Okay, how do I define fitness? I guess if you're able to, uh, uh, like perform in a very efficient way without difficulty, then you're fit.
Okay. We'll take it. We'll take it.
How do you define it? I'm curious.
I go a little bit off of the CrossFit definition, so I'll give them credit for it. So it's kind of work capacity over broad time and modal domains. So to your testing concept that we were just talking about, I like I would certainly choose a different barometer of tests. I understand the PPS's kind of idea behind it, and sometimes I'll go ahead and call out the physical therapy profession for underloading. And again, you put out there, can you lift 20 pounds from the ground? Now, yeah, if you can't lift 20 pounds from the ground, that's something we should certainly be building up. I'm confident that if a 75-year-old woman who has never touched a weight in her life walks into my clinic, I can get her lifting close to 75 pounds, if not 100 pounds on that first session. So in terms of work capacity, that's one way to find it. The other one I like, and I'll give credit to a physical therapist from New York City, who I had on a recent episode, Strength in Motion, Joe Lavaca. If you're familiar with him, he was over in the Union Square area. He defined it as the ability to adapt. How well can you adapt to different physical challenges? So again, going in line with your kind of concept of how well do you stand for an hour? Do you get pain? So there's definitely some overlap there. But it's interesting because your answer was not too far off from the National Association of Sports Medicine or the National Strength and Conditioning Association. They kind of had these ambiguous, and I don't want to say your answer was not phenomenal. I caught you off guard there, but but they published pretty much something like that. That's like, yeah, it's your ability to live life and be pain free, and like whereas again, like that's the one thing that I kind of fell in love with CrossFit when I first got into it back in 2010. Not that the concept of CrossFit or not, that everyone should just go and do a CrossFit class. That's a whole different conversation. But I like the fact that we can measure, we can talk about multiple tests. We know what is going to improve your quality of life. So that goes to the kind of fitness concept we're talking about here. If you have improved leg strength, if you have improved grip strength, if you have an ability to get up and down off the ground, if you have an improved VO2 max, these are all things that have been shown to improve your quality of life and your length of life. So it's fascinating stuff. And again, I'm actually doing a TED Talk or preparing a TED Talk that's about redefining the concept of fitness. It's not just getting on a bike, getting a sweat, and that's the end of your day. Like with the Peloton that became so popular during lockdown, I want to challenge the public and say, hey, like, that's great that you got maybe a little bit measurably better at riding a bicycle. Maybe that improved your cardiovascular fitness. But let's actually challenge that and do a 12-minute Cooper test, which has standardized data that we can compare to people in your age range, people in your weight group, and then see if that number improves over the next 10 years. And if that does improve, then we know, we are pretty certain based on evidence that all other things being equal, you might live a little longer and you might live a better quality of life and be able to continue to do the things that. Anyway, I took over that a little bit. You asked me the question, and something I'm very passionate about, and I'm working on a 18-minute TED Talk that I'm trying to narrow down. But yeah, the redefining fitness is something I think that anybody who's promoting fitness, wellness, like, I think it's important that we do have those conversations and continue to refine how the public sees it and how they, again, is it just I have a six pack, or is it, oh, like, I can carry 70 pounds in my right hand 100 meters and I can only carry 50 pounds in my left hand for 100 meters. Like, that's a functional fitness thing. And that's something that if we can figure that out, test it, put it into this system, and then get you better numbers there, you can measure that over the rest of your life. And the aging is I just read a book I'm going to share. Then I'll come back to you. Sorry, you got me excited about these topics though. A book called Lifespan by David Sinclair, and the subtitle is Why We Age and Why We Don't Have to. And he's basically making the argument that aging should be considered a disease. And again, I do think back to the original point here is physical therapists are the best aligned to and best positioned to be the providers of choice to help people age better. And again, it's something that, again, I'm very passionate about. I'm excited about it. And I love hearing and seeing what kind of wellness programs are out there where, again, it's not just, okay, you have an ACL tear, you had a surgery, let's take you through the protocol. It's, okay, you had that, and now let's make sure you're now stronger than you ever have been, first of all. And then we're going to make sure we really do what we can to make sure you don't have another ACL injury. And again, you feel really confident about skiing again or whatever. And yeah, just have that deeper, longer conversation about quality of life and again, being that musculoskeletal provider. So anyway, I'm going to stop talking because I apologize, Kristian. But yeah, I don't. Do you have thoughts on that? Do you want to pick?
Yeah, absolutely. Like we have our own post discharge program where our patients can check in with us every month, once a month or twice a month if they are, say, playing golf and they just wanted to make sure that they're performing better. And again, like each visit, they learn something new. The education part of what we do is so important that, they do whatever they do best, and this is what we do best, and that's why they come to us. Awesome. So the care doesn't stop on discharge.
So aftercare, we're talking about aftercare.
Aftercare. Oh,
or
yeah.
Life care. I keep playing around with.
There we go.
There's healthcare, and again, unfortunately, most of the healthcare system does not care about your health. They care about your disease. They care about sick care, symptom care, and that's what we have here in America is more of a symptom care system. And yeah, it's going to take folks like us. I think health coaches are emerging to talk about blood work and all these deeper conversations. So yeah, I'm excited to see where it goes for sure. I'm excited about what you guys have going on, those kind of programs, the aftercare model, if we can call it that. But yeah, thank you so much for sharing all that back end stuff of Tribeca Physical Therapy. Let us know where folks can find out more info if they're in New York City, how they can work with you guys,
Yep.
insurance, cash based,
Yep.
all that.
So so we're located in 225 Broadway, downtown in Tribeca, 27th floor. We have the view of the beautiful Woolworth building, and again, like we're trying to scale to 21 locations. So watch out for that. It's like a bold statement that I'm doing, but you have to do it for it to become to make it happen. We are. You can follow us on Instagram at Tribeca Physical Therapy and Facebook. And you can contact us at 212-406-8080. And even if you're not in New York City, as long as you have a residence in New York, we can do telehealth with you. So that's going to be covered by our license in the New York State. They allow us to see people who are outside New York as long as they have a residence here. So that's something that is you guys can keep in mind.
Awesome. Very excited, man. Excited to keep seeing the evolution, hearing about that next location. Maybe we'll open one here in Colorado. I don't know.
Absolutely.
We'll talk.
Oh yeah.
We'll talk.
It's superior.
It is superior. We are superior here. Awesome, brother. So thank you again for your time, Kristian, and looking forward to our next conversation. And we will sign off, guys. Hopefully, I will throw that last pitch in there. If you enjoy the conversation, look up Kristian, reach out, send any questions you have to either of us. If you got 1% better today, make sure to share it with someone else who you think can benefit from it. Don't forget to rate, like, review, all that good stuff. It helps the podcast grow and reach more people and hopefully improve this broken healthcare system that we have. And we're going to leave it off on that sad note. Yeah.
I actually have a quote to like close this, if you don't mind.
Go for it.
So a healthy man has 10,000 problems to solve. A sick man only has one.
Perfect. I love that quote. I've heard it before and I love it. And we will sign off on that, guys. Hopefully we can, again, keep moving everything in the right direction. Talk to you guys soon. Get 1% better.